Good afternoon, ladies and gentlemen. Once again, I greet you. This is Miss Connie speaking. Like I said before, I'm the founder and I'm the owner of Gumethra Healthcare Training and Assessment Institute. Today I'm here to share a few things with you. I'm talking to you. You. Stop doing this when checking blood pressure. I'm talking to you who's looking after elderly patients, who's looking after your loved one, who's looking after patients at hospitals, at home based care, at clinics, in the patient's own home, and so on. So, what must you do? If you are taking care of an elderly patient or a sick loved one at home, stop scrolling now. Stop scrolling and listen attentively because this is going to benefit you. It's going to benefit your patient. It's going to make sure that your patient is safe enough because you're going to follow the guide that is required. So, nobody gave you a manual when you became a caregiver. So you are probably tracking blood pressure completely wrong because you were never informed, you were never guided, you were never told how to do it properly. So that is why Gumethra Healthcare Training and Assessment is here to guide you so that you can do the proper way of recording vital signs because vital signs are very important for us to be able to know whether our patients are healthy, whether they are recuperating, whether they're becoming better, whether they are progressing in whatever medication they are taking. We need to know the baseline of their vital signs. So that is why vital signs are very important for us to know on how to record it properly. So, how we are going to do it? We are going to use a blood pressure machine. This is a digital one. It's a digital blood pressure machine that we are going to use so that we can record the vital signs for our patient. And also here we have got a thermometer. This is what we are going to use also to record the temperature of our patient. So it is very much important that you must have these equipment so that you can record your patient's blood pressure and temperature and pulse and respiration accurately because we don't want to give the wrong readings and then we are going to panic because it's only our own fault. So what must people do is this. What must you do as a caregiver when you are looking after your loved one, you are looking after a patient in a hospital, in a home based care, in a patient's own home? Most people just throw the cuff on their arms and hit start. It is very wrong. You cannot just call the patient or just arrive at the patient's home and then you just put on the cuff, you start recording. No, 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 no. It's a big no, no. It's a big red flag. What must you do? Did you know that if their bladder is full or if they are talking to you during the test, it can artificially spike their top number, which is the systolic, by up to 15 points? You could be panicking over a fake medical emergency just because you are doing it wrong. So let us do it the proper way. I am going to guide you. I'm going to give you all the details that you need to know so that you can never give a wrong reading to your patient. According to clinical standard, your loved ones need to sit completely quiet 5 full minutes. They need to sit quiet for 5 full minutes. Why do we want them to sit quiet for 5 full minutes? Because we need them to relax. We need them to relax so that when we are taking the blood pressure, there is nothing that is triggering a wrong reading. So their arm must rest loosely on the table at heart level. That is what is supposed to happen. When when you are going to record the vital signs or the blood pressure, you must make sure that you have a table. And then put the patient arm on the table, make it loose. Let it rest loosely on the table so that the patient can relax. The blood also running through the veins must relax. One tiny but very helpful information is that doctors don't care about the number that is displaying on the BP machine. No, they don't care about that. They don't care about whether it is 160 over 200 on that specific day. What do doctors need? Doctors need you to have daily a daily log where you record the abnormalities of each and every recorded vital signs. As you are going to be with your patient, as you are going to be with your family member who you are going to look after, you must make sure that you create for yourself a log book where you are going to record each and every day recording in that book for vital signs, because we need to keep track of what is happening with the client or our patients. Because the reason why we are recording the vital signs is so that we can be sure whether the patient vital signs are within normal ranges. So if the vital signs are not within normal ranges, then we need to make sure that we're going to record it on a daily basis, so that when we are going to call the doctor, we'll be able to explain to the doctor that on day one it was 167 over 200. Day number two, it was 200 over 150 millimeter of mercury, or that is the way that you're supposed to do it. You cannot just report something that happens only on that specific day. We need to have a record of what is happening with our patients. Good. So, now, one other thing. We at Gumethara Healthcare Training and Assessment Institute have made this process easy, very easy for you. Because why? We care about our patients, we care about the community, we care about our elderly patients. That's why we came up with this guide that is going to help you as a caregiver, wherever you are going to find yourself, whether you are at work, whether you are at home. It's very easy. There is a guide that is called the 7 core nursing skills every caregiver must master. What you can do is just you download it, you put it on your phone, you put it on your laptop. Whenever you need to be guided, you just open your phone, you open your laptop, you just get the information that you need. You are going to look after this patient properly, and we are going to have healthy patients. What we are going to care when we are going to start using this guide, the only thing that we are going to care about, that we are going to be confused, or that we're going to be thinking more about, is just for the patients to live longer, because we know now what we're supposed to do in order for us to get the correct vital signs, how to transfer patient properly, how to feed patient properly, how to administer medication properly. All of these things is in this guide, so that we will know exactly how we're supposed to care for our patient. Because remember that a caregiver is the backbone of the health field, of the healthcare field. The caregiver is a backbone. What is a backbone? Even on you as a human being, what is a backbone? Without a backbone, you won't be able to do anything at all. You won't be able to operate any kind of thing, because the backbone is not there. So that is the importance of being a caregiver. You are the backbone of the healthcare system, meaning that you are very, very much important. Count yourself as a very important person. So, as a caregiver, I am going to give you these 7 critical nursing skills that you have to handle at home every single day, from tracking vital signs to safe patients, transfers, and so on. Like I said before, we need you to be on par, so that when you're going to look after this patient, it is going to be properly. Here is the guide that Gumethara Healthcare Training and Assessment Institute have created. It's the 7 core nursing skills that every caregiver must master. You must have it, because we need you to know how to report your vital signs. Okay, let us see where we are going to do, where we are going to check about the vital signs. Skill number 2 in this book is about vital signs. So, what you must do is grab yourself a copy directly through the link on my profile page right now. Grab yourself a copy right now, so that you will know exactly what you're supposed to do when you